you'd help me with the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And if you'd call the roll, please. Bring mine up.
Will Elder,
Yes.
Jason Dawson, Mark Hickman, Ryan Williams,
Here.
Zach Jeffrey,
Here.
Jennifer Massey.
Here. Dawson's here.
Oh, he just showed up?
Running.
Oh, there he is. He did make it.
Jason Dawson,
Thank you for coming, Stacy. And we do have a quorum. First order of business is the approval of minutes, January 25.
I move that we approve the minutes from
Wait.
January 25.
Do we have a motion? Do I hear a second?
Second.
Do we have a second? All in favor, aye.
Aye.
All opposed, same sign. Next is financial, January 2022.
I'll make a motion, we accept financial, January 2022.
Do we have a motion? Do I hear a second?
Second.
We do have a second, and this financial, we will call a roll, please.
Will Elder,
Yes.
Jason Dawson,
Yes.
Mark Hickman,
Yes.
Ryan Williams,
Yes.
Zach Jeffrey,
Yes.
Jennifer Massey.
Yes.
Thank you, guys. In general, we have ordinance 2022-02. It's repealing the ordinance. Dustin, you better be on the top
Sure,
of this
I'll
one.
chat about this. You guys, in 2020, we passed ordinance number 2020-7. This was one of the first ordinances I worked on. My memory of it was I was asked to do it sort of at the last minute on the last day that it was due, right before it came to the meeting. When I do ordinances, my usual process for this is to do a draft of it, circulate that around, let the municipal league look at it, do a lot of research about that. And in this case, we did not have a chance to do all those things. I was provided with, this is just a photocopy of the ordinance that was from Bologna, and we sort of borrowed that. This concerns manufactured homes. So we kind of took it for granted that if there's another town in Faulkner County using this, then it must be okay. But we have since learned that this has the potential to be problematic. There's some other towns that have had legal problems with a similar ordinance to that. So just an abundance of caution, not being threatened or anything, we think it's probably the best course to do a repeal of that.
I mean, you have talked about this, but also the new zoning laws will maybe take
Yes,
care.
Yeah.
Am I right?
And the new zoning law that we will be adopting soon with Metro Plan will encompass all zones. And you know, we do have all sorts of very valid concerns about manufactured homes, the nature of them, where they're gonna be, the appearance of them, all that. All those things are still fair game. The one item on here that is the most controversial is that having been built in the last 5 years. And there's been some similar litigation about things like that, that we're just trying to avoid problems. So that's.
So I would entertain a motion to suspend the rules.
I make a
This-
motion.
Will, you understand?
Pardon?
Well, we can get to that. We gotta suspend the rules first.
I make a motion that we suspend the rules, waive the second and third reading of ordinance 20-02, read the entire ordinance or read by title only, and vote on ordinance 2022-02 after its initial reading.
Have the motion. Do I hear a second? To suspend the rules.
Second.
We do have a second. All in favor, aye.
Aye.
All opposed, same sign. Now, if you read the title, yes.
The City of Mayflower, Arkansas ordinance number 2022-02, an ordinance repealing ordinance 2020-07 in its entirety, declaring an emergency and for other purposes.
Okay.
I move that we adopt 20-22-02 to repeal.
Okay, we do have the motion.
I will second that.
We do have the second. Please reinstate that motion.
We're gonna get to the discussion.
Right after reinstatement. Yeah, well, I'm getting there.
We have a
Please
we have a
reinstate.
motion and a second
Okay, and so now discussion is open.
Okay, what my concern is, I understand why we need to do this, but we've had a problem with people putting junky mobile homes, moving them in, and, buying one cheap somewhere and sticking it in with, and then not, putting underpinning on it in the proper times, or, in other words, how are we going to keep people from putting something in that's not acceptable, and then it's the very devil to get them out, or, in other words, we've got a problem with enforcing, having decent standards where I understand we can't control the appearance of them, but we can be sure that they're properly installed and plumbing and heating and everything's safe.
Right. Now, the one thing, the zoning will take care of part of like the,
If it will.
The law, and there's 2 or 3 different chapters of the law that pertain to this, but it allows us to regulate it in more ways than you would think. We can regulate where they are. You can regulate the safety of them. They still have to have a building permit to install one. We have to have a certificate of occupancy to do the safety issues of them. You can regulate the appearance, that require them to have underpinning and siding, and carports, all sorts of things like that. Location, appearance, and those are but what you can't do is put an arbitrary, that it has to be built to within a certain year or a value. Those are 2 examples of things you can't do. It runs a violation of Arkansas Affordable Housing Act.
When you just say that the metro plan
right there.
The Metro Plan is in draft form. What's our
It's almost the
timeline?
last draft form that it will go to the planning, and then it comes straight to y'all, and y'all have to vote on it. Well, you can talk about it, but it's an ordinance. Y'all have to do an ordinance on the whole.
It's be a very large ordinance.
Yes.
It's hundreds of pages.
maybe where wheels go from is, I hope it don't take 6 months, and in the meantime, they move in a bunch of mobile homes and stuff that we don't want in the city. And hopefully the inspectors catching that
Yeah.
and doing what they do now, so.
Do you know the timeline on that at all?
I don't.
I know they're on their last
I've-
draft, so, well, my meeting is tomorrow, I guess, with them, so.
And that will replace a lot of what we're doing. So at best, what we've got here is just, our rules are just gonna be unnecessary and replaced with the Metro Plan rules.
And I guess the ordinance would be probably on next time, I guess, that we meet. That's what it's looking like right now, if Metro Plan makes that happen, so,
Is there any type of permit they have to get before they can move a mobile home in?
yeah.
Building
So
permit.
we would, like you said, you don't want them to move in a bunch, in the meantime, but we would know because they'd have to get a permit, right?
And also, they have to follow the international codes. That's what we are under. So they would have to do the underpinning and all the whole bit.
And I've got a question. When we vote to repeal this ordinance, didn't I read somewhere that it reverts back to the old zoning ordinance that was on file anyway?
Yes, yeah, that we've had for
So
decades.
it's not
yes.
like it's gonna be a free-for-all, and
Yeah.
for mobile homes in the city of Mayflower, they're limited on the zones that those mobile homes can be
That's right.
placed
Yes,
anyway.
right. And then the short term, you're gonna have the old zoning ordinances, and then when y'all adopt it, which hopefully will be next month, it's about a month's time, I guess, is
It'll
what
be
you're
more
looking at.
comprehensive.
A lot better. It'll be everything will be a lot better. We do have a motion and right, and a second on the floor. If you'll call the roll, please.
Will Leonard,
Yes.
Jason Dawson,
Yes.
Mark Hickman,
Yes.
Ron Williams,
Yes.
Zach Jeffrey,
Yes.
You do have an
Jennifer
emergency
Yes.
clause, right?
It does have.
Okay. We do have an emergency clause. I would entertain a motion for that.
I move that we accept the emergency clause for ordinance 2022-02.
Do we have a motion? Do I hear a second?
I'll second.
All in favor? Aye. All opposed? Same sign. Okay. That one's one out. Next, we have resolution 2022-02. and it's donating the air packs, is that correct?
Yes, we talked about this, the last meeting. This is just the written form of it, donating 3 air packs, or are they air packs? I wrote fire packs on here, but is that
Air pack.
air packs? Okay. With spare bottles, masks, and related accessories, 3 to Pine Village, 3 to Centerville.
I move that we adopt resolution 2022-02.
Second.
And we have a second. All in favor? Aye. All opposed, same sign. Next, we have CenterPoint Energy. The franchise transfer is just going to another name. And in fact, we can do this with just a motion, am I correct?
Yes, the ordinance goes back to May 25th, 1948. It's ordinance number 30 of Mayflower. Granted, was to what the original company for the gas system, and since all over the decades that's changed hands, these companies do this from time to time. So CenterPoint is now Summit, and they even have the trucks painted. You see them driving around. I've seen the trucks painted. So this is just their internal assignment. That CenterPoint is assigning their franchise agreement to Summit, and this is just their agreement, and they're just asking us to adopt that.
And we can do that through just a motion, right? Am I
Yes,
correct?
yeah, they have a
Okay.
right to do that, but they really just need this file marked with Barbara's seal on it, and a copy of the minutes from tonight's meeting. They just need that for their
Little
records.
aside, one would hope that the new people will be easier to deal with and get a hold of at CenterPoint.
I make a motion, we adopt the Summit Utilities franchise transfer.
We do have a motion. Do I hear a second?
Second.
We do have a second. All in favor? Aye.
Aye.
All opposed, same sign. The next one is Pafford for EMS presentation, and we have Clay Hobbs and Jamie Pafford, the main lady, is here tonight. We appreciate y'all being here, and if y'all got a presentation for us? Yeah.
Okay. Well, thank you for having us this evening. I like to joke around that I manage emergencies for a living, and I pretty much have been doing that for the last 3 weeks, trying to figure out what is going on in Faulkner County. So as he said, I'm Jamie Pafford, and I'm the CEO and president of Pafford Medical Services. My parents, and I think our goal here tonight is just to tell you what has happened and what has taken place. Currently, we have been chosen as the provider of the city of Conway. And just a little bit ago with one of the JPs here, we were selected as the county ambulance provider. And the intent is to start on March 1st. Like I said, we manage emergencies. It is an emergency, March 1st. That's just a week away. And so what we'd like to do today is just tell you a little bit about us, what our plan is for what's going on, and how can your city be a part of that at the end of the day. I think, so you know a little bit about me. My family founded the ambulance service, my parents, in 1967 in Magnolia, Arkansas. This February, we celebrated our 55th year in business. And both my parents don't work in the company anymore, but they gave us some really strong values that my brothers and I take to heart. And I feel like that we are very positioned for the future. I'm looking at the third generation in the face because both of my kids and my son's son also work with a company. So we have a long history of taking care of communities in Arkansas and other states, and we look to do it in the future as well. You know, when we talk about position for the future, it's not only about the third generation, it is really about the connections that we have across the state and that we've been able to form over the last 50 plus years. I serve on many boards and commissions, as well as several of my directors do the same. So I'm the American Ambulance Association secretary, and I've been a board member for over 25 years, so it's something that's near and dear to my heart, is to talk about all things ambulance. And just in case you were wondering, I've heard the word ambulance every day of my life because I was born in 1969, so it's very second nature to me. But that strong network that we've set up across the state and out the United States has allowed us our growth that we currently have. You know, the Pafford today and the Pafford that many people knew 25 and 35 years ago, it's a little bit different. I get to have open roundtable discussions with some really keen people in EMS, and that's how we make our decisions these days. It may still be at a supper table some nights, but the fact is we're getting good information, and that's what we feel like we've done for Faulkner County. We've looked at your whole county. You know your county and how you get to places better than anybody else, but we've actually asked, you know, what do we need to do to provide the best service possible in the community? And I think that's what we do for you. You know, I talk about my greatest asset. This is not the face of Pafford. It just ends here at the end of the day. My greatest asset is the men and women that are in and out of the trucks each and every day, and they're very valuable to us. And this is something that our parents instilled into us, and it's very easy to do, is to take care of them. And I truly believe, and as do my brothers, that if we can take care of our people, give them good tools, good places to work, make sure that their pay is adequate, and that I can continue to educate them and make sure that they have a great skill set and good equipment, then they're going to turn around and hopefully pay it forward and take care of the community. And that is the whole goal here. When we talk about employees here in the area, y'all have a plethora of medics within the community that we're hopeful that will want to come and take care of their own. That will be the real goal here. Yes, I can pull people in, and I can have staff here, and we'll make sure that we're covering our bases, but at the end of the day, it would be a blessing to be able to have folks from here working on your ambulances, taking care of your people. We have a really large footprint, and I'll be very mindful of your time, but just so you know, I love to call myself a mom and pop rural ambulance provider, but the fact is I'm kind of big, and most people don't realize that. We're in 5 states in the U.S. Virgin Islands, and that's a fun one, and I don't ever get to go down there, but we have several federal contracts that we work out through that. With that being said, we pretty much have 1,600 employees right now in those service areas. But in Arkansas specifically, yeah, I saw somebody's eyebrows raised. Yeah, mine raise every Friday when I have to make payroll. So it's real. It's definitely real how much growth that we've had in the last several years. But in Arkansas, we're in 14 counties, and you guys can do the math. That's 20% of the counties throughout the state. And we are the largest provider of EMS services across Arkansas. And we like to, no two services are alike, and that's why each and everybody has to stand on their own 2 legs and make sure that we're taking care of what your needs are. The ambulances may look the same and the uniforms may look the same, but we need to make sure that we're responding to your needs, and that's what we feel like we've done. Somebody had to put it in there. I'm in the EMS Hall of Fame, been doing it a long time, I think is the point there. And that we've also been selected as the ALS Service of the Year, as well as the 2021 Business of the Year. And the one I'm most proud of right now is out of the 14,000 ambulance services across the United States, my service won the National EMS Service of the Year. And so I can't sing the praises of our guys enough to other people, because I have no doubt in the last 2 years, toe-to-toe, they have worked as hard as anybody else in healthcare, and I'm very proud of them. So we do offer a lot of services. We have our own 911 center, and we're integrated and we're the 299th ACE accredited dispatch center in the country, and we just received that designation last month, and we're very proud of that. But we have every intent to work with the current 911 center that's here to make sure that our ambulances are responding at the same moment that the call is being paged out to someone else. We have both air and ground ambulance services, and I've been billing since I was about 14 years old, so we have our own billing operation, as well as the medical alerts, help if I fall and I can't get up, or some other system like that. And then on-site services. We do a lot of concerts and school events and just all kinds of things. We also have a specialty response team that goes all over America taking care of disasters, and we've been doing that for quite a long time. We can put anywhere from 5 to 15 trucks up at a moment's notice for something like that. And so we have a strong pull there from a national level. So Clay Hobbs is my Director of Operations, and I'm going to let him tell you how we've designed what's going on. And like I said, you know, our ask here tonight is just to be a part of your community and for you to embrace what we're trying to do in the community as a whole and in the county, and for you to understand where we're coming from and why we chose your spot and what's going on.
Thank you so much. My name is Clay Hobbs. I'm the Chief Operating Officer for Pafford Medical Services, and I'm just going to walk you through kind of the timeline. About 3 weeks ago, we were approached by the City of Conway to provide ambulance service to them. And fast forwarding, we just received approval this evening from the Quorum Court to provide ambulance service under franchise. So we have a franchise in place both with City of Conway and then with Faulkner County. We really looked at what the needs of Faulkner County were at the same time that we were addressing the needs of the City of Conway. We knew that there was going to be a void left in the county, and we were cognizant of that. The City of Conway asked us to please start planning for that, how we're going to integrate the system together to not only work with their ambulances but also take care of the county. We wanted to make sure that we brought the fire departments in from day one, and that we were able to integrate the ambulance system in Faulkner County into the fire departments and the fire districts here. We also knew that the hospitals played an integral role of what we do pre-hospital, especially as we're in the middle of this pandemic. So from day one, we've worked with Conway Regional and Baptist Health to make sure that the EMS system integrated with the hospital's needs and expectations. The hospital is working together with us to provide medical direction and other services that we can integrate not only into the ambulance transport system, but into our first responders and our fire departments. We will have an advanced life support paramedic system here within Faulkner County. That system will be in a tiered response, which will include 911 pre-arrival instructions. So if someone calls 911 and requires directions for CPR, choking, or childbirth, our communications center located in Hope, Arkansas, will actually be providing those services for the county. We will integrate fire department first responders at the basic level in the county and then at the paramedic level within the City of Conway. And then we'll have BLS and ALS transport ambulances. We brought together a fire station-based approach to the ambulance service for Faulkner County. And we did that because we believe in planning, training, and responding together with our other first responders. We knew that we needed a public-private partnership with the county and with the cities and the volunteer fire departments all working together to provide pre-hospital services. We're going to base the ambulances and fire stations across the county, and then we'll have these resources positioned throughout the county to decrease response times to every resident. And we'll have the ability to move the ambulance resources within the City of Conway and within the county in one seamless system to make sure that everyone has appropriate ambulance coverage. We talked a little bit about the hospital integration earlier, and we are meeting regularly with both hospitals and providing additional services to them. So our hospitals are taken care of, and transfers both at the advanced life support and basic life support level are taken care of. So if someone has to be transferred from one of the Conway hospitals, we're able to do that. We took the 911 call data from the last couple of years, and we were able to identify where calls were in the county, what response times were going to be, and we came up with a decision that the best opportunity for county residents was to have ambulances located in Greenbrier, Mayflower, and Vilonia. That made the most operational sense to be able to cover the ambulance calls with 3 ambulances.
And you also have 4 in Conway?
Yes, we'll have 4 units in the City of Conway, and then we will have a 5th unit in the City of Conway that the Conway Fire Department personnel will take out if we are at a last-ditch effort. We have no additional ambulances available. That's our safety net ambulance. So by looking at where the cities are within the county, we can tell that we can get to most of the areas in the county, the most populated areas, in under about 15 minutes. We have to remember that driving directions or driving and geographical difficulties are going to preclude us from doing that in the far outreaches. We believe that we will have extended response times just based on how long it takes to drive to a residence in some of the most distant locations. we just took this map and just looked at the county and where where the cities were and where the fire departments were that we needed to integrate with. So the initial ambulance placement, we talked about 8 ambulances, a combination of ALS and BLS ambulances, 4 in the city, 3 in Faulkner County in respective cities, and 1 redundant ambulance. And we're going to continue to work together with all of our fire departments and government entities to make sure that we have the proper placement of ambulances to maintain the response times that we've outlined. We discussed that we'll have those ambulances in 3 cities here in the county. Our communications center is really the first responder. Our dispatchers and call takers are the first person to speak to that person that's having a medical emergency or the family member. We will integrate with Conway and Faulkner County's 911 system. We want to have the simultaneous dispatch of first responders, so when the fire departments are being dispatched, we want an ambulance dispatched on the way at the same time without delay. We will be providing those pre-arrival instructions from our communications center, and our telecommunicators and dispatchers will be monitoring the situation and dispatching ambulances appropriately. We'll have an AVL and GPS feed to the Conway and the Faulkner County 911 Center, so the local 911 center can actually see where the ambulances are in real time. The fleet, we talked about the ambulances. We'll also have a response vehicle for an on-duty supervisor here. We'll also have a disaster and firefighter rehab trailer that will be located within the county. We want the community here in Faulkner County and Mayflower to have ownership in the ambulance service. This is your ambulance, it's your asset to take care of your residents. So we are appropriately branding the ambulances for Faulkner County. And I'll give you an example next of just what the ambulances will look like that are based here in the county. It'll look like a standard Pafford ambulance with the Faulkner County seal and name on the side of the ambulance. Each ambulance will be equipped with a Stryker power cot and power load system. We believe in having the absolute best equipment for our paramedics to take care of the residents. Each ambulance will be equipped with a Zoll X-Series monitor and a Zoll ventilator. Each of our paramedic ambulances has a ventilator on board. And we believe in integrating that equipment with the fire department and first responder agencies. So we will be working with the Mayflower Fire Department to place the appropriate AEDs that will interface with our cardiac monitors for seamless patient transfer and care. And then we'll also work with them for medical supply bags, and any of the medical supplies that they use on an EMS call, we will replace on a one-for-one basis. We also have a backboard exchange program and oxygen exchange program that we'll be working with the local fire department. We'd be amiss to say that COVID hasn't been challenging. We've probably been through one of the most challenging 2 years of my life and my career. And our people have risen to the occasion each and every time. These are just a few pictures of how our staff has had to respond and transport patients throughout our coverage area. Early on with our patient zero, we activated our emergency operations center the first day of that situation. And that communications center and EOC has been operational 24 hours a day, 7 days a week since that hour. Our center has been able to provide our employees with a sense of being able to call in for medical advice, to get COVID tested. We've also been a resource for our communities, our cities and our counties, to interface COVID testing and COVID mitigation. And then our hospital and healthcare partners, we've worked with them to arrange transfer of patients across the country when we ran out of hospital beds right here in Arkansas. So that center and our mitigation with that has been paramount in us providing service. Again, here's just a few pictures of our staff testing and responding to calls. We believe in transparency and accountability. So we will be providing daily and monthly operational performance reports to the county and to the cities that are participating. And as Mayflower would be participating, we would provide status updates and reports to you periodically about how the ambulance system is functioning and how things are going. We already talked about us receiving ACE accreditation for our communications center. We have a third-party entity that maintains our quality assurance and control in that to make sure that we truly are meeting the mark with our transport, with our 911 calls for our transports. Our clinical operations are extremely important. Our medical direction is provided by our chief medical director, but we also have local physician involvement from Conway Regional and from Baptist. We will provide physician medical control to the Mayflower Fire Department for the EMS calls that they respond to at no charge. We talked about our advanced life support equipment already, and then we also have our quality assurance and review program, which we will integrate Mayflower Fire Department into that to make sure that we're meeting our clinical performance indicators and our patient satisfaction. This has been a pretty quick and robust integration. So we believe in one team and one mission, and we've truly been running since day one to make this happen and get the system integrated. We've been working together with all of the county and city departments that we've been in contact with to make sure that we can provide service on day one. Your fire chief has been instrumental in working with us from day one, has shown a great interest in us being here and being involved in the community, and we appreciate that. We do plan on providing continuing education for the first responders here in the community, including police and fire, and then just participating in training drills and so forth here in the community for disaster situations. I won't go into too much detail about our key performance indicators, but this is just how we measure how the EMS system is performing, both from a response standpoint and a clinical standpoint. And that's reports that we can give back to you to show you how the system's functioning and be transparent. So I'm going to turn this back over to Jamie to talk about our community outreach and involvement.
So I think it's important that people see us before the 2 a.m. call where you invite us into your house. So our medics that are here, it'll be important for them to be involved in community outreach. And that just puts a face with the ambulance and have some reassurances that they're going to be here and they're going to be taking care of business. And we do that through many things: stop the bleeds, CPR training, just being a good corporate citizen, being involved in the school systems, being seen around and about. That is important to us, and is part of what we like. We feel like that we stand out when we are able to do things like that. We are growing. I've told you guys that. We went live in Saline County February 1st and in Mustang, Oklahoma. So we have a lot of communities that are choosing this model to have our ambulances placed in their fire station and having that public-private partnership where we both have skin in the game, but yet you have a real asset just like it's your police car, your fire truck. This is your ambulance within your community. And just last week I was featured in EMS World just talking about how Pafford got started. And it's a fun story, so if you happen to run across it, it just tells a little bit more depth about why I do what I do and how much we really love EMS. Again, this is Service of the Year, and that was no easy feat, and I'm very proud. That is actually my brothers, and my son and daughter are in that picture, as well as my nephew, and some of our main staff that is just the backbone of what we do. So I'm really proud of my family, and I really do believe that we can take care of your people, and we would hope you'd give us the opportunity to do that. With that being said, pretty much what we're asking for you guys is for you to approve for our partnership to be in your fire station, and that we report to you. We understand what we're doing. We understand that we're visitors in your community, but we want to be a part of your community, and we would just look forward to that opportunity. We're going to be in the county somewhere, and we'd really like to be right here.
Thank you, Jamie. Great presentation. Dustin, you had a...
Well, yeah, and I met most of the crew this morning. We had this same meeting in Greenbrier talking about these details, and so the franchise lies with the county, and we know that they met tonight. Also, they've approved their franchise. So Faulkner County will have Pafford, and they'll be the provider. So the question is just will we allow space in the firehouse for theirs? And they know what I'm going to say about Greenbrier is that I encourage them to adopt a sort of a written plan of understanding that talks about all details, big and small, as to whether We talked about integrating these radio frequencies and how that's gonna work, all the way down to who pays for the coffee and the toilet paper and things like that. They will have more, they'll, hour by hour, their staff will be in our fire station more hours than our people will. So that kind of creates a different dynamic that we just need to write down. Your goal is to start March 1st, is that right? We will meet, you'll have your next meeting on March 22nd, which will be 3 weeks in, and by that time, we will know more about what works and what we need to fine tune and things like that. So I would encourage you all to take a preliminary vote that welcomes them for March 1st, pending the approval at the March meeting of some kind of memo that just talks about, just something we can tape on the wall. That
So we
says-
do need something now as a preliminary motion, right?
Yes, yeah, just to accept their plan for the time being.
Make a motion to temporarily allow Pafford Medical Services to be housed in our facilities pending a final vote and approval of supplies and financial responsibilities and the MOU at the end of next month, our next meeting.
We do have a motion. We do have a second. On this one, we're gonna call a roll.
Would we not ask the fire chief, since it's gonna be in his house? I mean,
We can ask him?
Yeah,
It's
it'll
right
just
there.
be for discussion of that, so sure.
Yeah.
So just what,
Do you want the ambulance to be in the firehouse, Chief?
I believe that's right.
Can I ask a question?
Yes, ma'am.
Okay, I understand that you're being ambulance housed in our fire station. Is there going to be someone there manning that ambulance from your crew? Is it like 24/7, you're saying? Okay, so there'll be like two people there all the time, so
Is
if they
there
get a
room?
call.
okay,
So-
I've never been in there, so.
I guess it was when we did our budget meeting, y'all approved for my remodel for this year. Well, we got a little fast track. Been talking with Pafford, Clay's been a tremendous help, and all of their crew. So we've started our remodel, as much as we can do by ourselves. Also working with the mayor. Pafford is gonna provide furnish a lot of household items, stove, refrigerator, recliners.
We appreciate that
Yeah,
too. guys.
absolutely. They come and met, I believe it was yesterday or the day before, and we went over all that. We have made room for them, and there's some growing pains, but it's gonna work out perfect, and we're looking forward to the partnership with them.
I think the biggest thing, we have all the questions in the world, but the biggest thing is our citizens now have access to an ambulance right there in your town that can
Yep.
be there in
Yes.
10 minutes versus
Absolutely.
30 minutes, and I think,
Absolutely.
It's a huge asset.
Big
Yep.
safety matter.
Huge asset.
I used to be an EMT a long time ago. I was trying to remember my number. I want to say 17,100 or something. It's a long time ago. But I was very familiar with Pafford Ambulance Service, and I was pleased with them back then, and I'm glad you're here.
But they're also gonna upgrade some equipment like they were saying earlier, so.
I know we do have a motion and a second on the floor, but I've got two questions that I want to ask Jamie. I know one of them's going to probably be silly, but is there any way we can put Mayflower on the side of that truck?
We can stick it somewhere.
Okay?
I think it's important to know that I do sometimes feel like a traveling billboard, and I've got over that part. But yeah, I mean, we do want it to be a part of Faulkner County. We want y'all to understand the fact that that is part of the whole entire system, and it's gonna go in and out of here daily, just
Sure.
like it should, and just be taking care of all the citizens.
I was just
The
trying to
blessing-
get it,
Yeah.
part of Mayflower.
Yeah, I'll figure it, but is the one truck gonna stay right here, will be right here. That's my understanding too. It
Yeah.
won't be in another station. Your truck is your truck, and you.
I mean, that'll
put a
look good
sticker on it.
with Mayflower.
Send me a
I do have one other question, radios. Are
I
you gonna
think
help it?
that-
Because I know that is a major problem with radios.
Yeah, I think everybody has that problem throughout the state and the United States, but the guys have been working very diligently to make sure that we can function in that way.
So we will dispatch the ambulances on the AWIN system countywide, and then we will have radios that we can integrate with the fire department. So their VHF radio system,
Okay.
we have the same type of radio in our ambulances.
All
So
right.
we can do that. We also welcome our first responder agencies when we're on an EMS call together to come to our frequency on AWIN. And most of them have a handheld portable.
Okay,
So-
Chief over there, is that your understanding on the radio stuff of what we're doing? Because it gets complicated with the radio stuff.
It's extremely complicated here when you have, so many different systems throughout the county.
Right.
And, but I think we've got the answer to it, and we've been
Great.
working on that since.
I know we'll need y'all to help us, Faulkner County too, so, yeah.
And I know with the additional ambulances that now that you're taking on Faulkner County, like for your employees, do you have enough already to staff?
So we've been very blessed that we've had several open houses and just job fairs, and we've probably had over 80-plus folks come through in the last couple of days, last week, and then we're actually interviewing on-duty supervisors in the last 2 days. So we've had a lot of interest. I think what the people need to hear is that y'all are embracing Pafford, and Pafford is going to be here, and we'd love for them to be a part of what's going on of your ambulance service. So as we do that, I think that they'll start coming. I know that the fire guys have been just great about filling out, helping fill in some slots to make sure that we have proper coverage. And so I feel very comfortable about it. We may have hiccups, it's still COVID. And just an interesting statistic, 42% of the licensed EMTs and paramedics in the state, only 42% of them actually practice. So, out of the 9,000 that there is, there's only less than half of them actually work on an ambulance. And that's where our struggle comes in. But we're hopeful that we can get some COVID's over. So everybody says, that's what we hear. But the fact is, hopefully we can get some folks to come back and work on the trucks and take care of their citizens. So that would be the goal.
Yeah, that's what I was thinking, because if you have somebody here 24/7, 7 days a week, I'm thinking you've got to have extra staffing now that you're taking on Faulkner County. So I was thinking maybe there's some of our own folks, that.
We'd love to have them, and I think that there's many folks in the room that have been talking to us and making sure that we can spend some time with them to see if we're a fit for them. I think we are a fit for most people.
Because I was
And
thinking
that's what you want.
Well-
That's what we want.
Several people that have
Yeah.
to cover all those
Yep.
shifts.
Yeah, and that'll help our recruiting of
Yeah.
that too. I
Oh,
know
yeah.
Ashton will know
I mean, it's here. It's right
Yeah.
here in the community, so.
that. Get some of our local
Clay,
people.
let me jump in, make sure I'm saying right. With the agreements with the city, that we're not exchanging funds or anything.
That's
Is that
correct.
right? So we're trading training and equipment, but no money.
And household.
You're not
housing.
paying us, we're not
Correct.
paying you for any of this.
Correct.
That's good for the public to know.
The county took care of that for the first 90 days,
Okay.
and that's what we asked for.
We do have a motion and a second on the floor, but I want it reinstated, please.
Okay, help me with this. Okay, Brian Williams made the motion to temporarily allow housing for Pafford ambulance service, depending on a memorandum of understanding.
That's correct.
Okay, anything else?
I think that was,
And
I think
that'll
that
be
was it.
presented at the next city council.
And then Mark Hickman made the second.
Okay, and so we will call a roll, please.
Will Elder,
Yes.
Stacy Dawson,
Yes.
Mark Hickman,
Yes.
Brian Williams,
Yes.
Zach Jeffrey,
Yes.
Jennifer Massey.
Yes.
Unanimous. So thank you. I appreciate that. Next, we have our reports. We have any reports? Is Raymond here? Or any others? Not so, any others? Announcements, I guess. City Council, March 22nd. Planning Commission is going to be March the 8th. And like we said a while ago, I'll probably, if Metro Plan gets through with the last draft of our zoning, it'll probably be in front of y'all next time, so. I'll try to get you that last draft, because it's kind of thick, for y'all to look at it. Have a little time to mess with it instead of just 3 days or something, because it's kind of an elaborate. And other than that, and I'll see what, City Council, anything? The public, anything? Would you like to say anything? If not even Doug? Doug, I would entertain a motion for adjournment, please.
Make a motion, we adjourn.
Need a second.